The Kano state government has been struggling to contain the latest outbreak of cholera. The spread of the disease has been rapid, with about 71 reported deaths. 2,179 cases have been recorded in the state. Though there had been reported cases of cholera in 2011, 2012 and 2013, government officials say the recent outbreak was unexpected and unusual.
Our own investigation found out that it is the defecation practice of the people that predisposes us to this cholera outbreak during this time.
GoTel News identified the victim of the outbreak and visited his home to see the level of hygiene. This environment is actually not that clean. Hashim, one of the patients we saw in the infectious diseases hospitals, live here. On arrival, another case has been reported in his neighboring house of somebody also exhibiting some symptoms of cholera. There are no public running taps in this community. Water is only provided by vendors with unverifiable sources. There have been claims of water contamination, but the government says these are untrue.
As for water sources, the Water Board for Kano tested water points actually during this outbreak, and we found out that the water point themselves, that is where people get water, is clean. It doesn't have fecal contamination, but it's only when they move to the households, that is when people now fetch water from the water point into their household, that is where the contamination sets in.
The rate of the spread of cholera appears to have been contained. Many patients have been discharged from hospitals across the state, but the root cause of the outbreak has remained a puzzle.
If we have good sewage system, if we have quality water supply, if we have good personal hygiene, then we might see the end of cholera. But looking at where we are now, our sewage system is not well developed. Still, we have issues with water supplies in some communities. We have issues with personal hygiene in some communities. I think we still might see, I'm not saying we will see, but we might see some outbreaks unless people take care of themselves.
There are already fears by residents of Kano that environments like this, which exposes residents to dirt, especially children, might increase the risk of another outbreak. Martins Dixon, GoTel News.